This video will talk about GoodPasture disease, or what we call Anti GBM disease. We'll talk about the manifestations, diagnosis, and management. As we mentioned in the vasculitis introduction video, the third type of vasculitis is immunocomplex vasculitis, and this includes three diseases. The first one is GoodPasture disease, Anti GBM disease. Second is IgE vasculitis, which is HSP disease. And the third one is cryoglobulin vasculitis. In this video, we'll talk about Anti GBM disease. So first of all, when do you think about this syndrome or disease? If they have vasculitis symptoms, the ones we mentioned before, including weight loss, fever, arthralgia, purpura, etc., as well as if they have glomerulonephritis, and glomerulonephritis patients present with hematuria and hypertension, as well if they have pulmonary hemorrhage. And how they present with bloody cough, and this represents around 40% of patients with anti-GBM vasculitis. Note that pulmonary hemorrhage can be seen in ANCA vasculitis patients as well, but it is more common in GoodPasture disease. So after you suspect anti-GBM vasculitis, you need to do some blood work, and this includes BMP, looking for creatinine for glomerulonephritis, and followed by urine analysis with RBC cast and dysmorphic RBCs from the glomerulonephritis as well. And on the chest X-ray, they will have bilateral patchy infiltrates. Now, you need to confirm or support your diagnosis. You will do ANCA, which is good for two reasons. First, to rule out ANCA vasculitis, and the second, if it's positive and on biopsy the patient as well have anti-GBM antibodies, then these patients, we categorize them as ANCA vasculitis and anti-GBM disease together, or what we call double disease. Then regarding management, these patients, we manage them with prednisone plus cyclophosphamide. And in contrast to ANCA vasculitis, which has indications for plasmapheresis, here all patients with GoodPasture syndrome should have plasmapheresis in addition to immunosuppressive management. And this is it for GoodPasture syndrome. See you in the next one.